Hi, fellow sports medicine students. I'm going to be showing you guys a series of special tests today, and we're going to start off with the knee. And the first special test is the valgus stress test. This tests for the instability of the MCL ligament or laxity of the MCL ligament. And you start with your athlete laying supine with legs fully extended. Then you grab the ankle and the head of the fibula and apply pressure laterally. And apply pressure. This test would be positive with pain or laxity, and if positive, there is a possible MCL sprain. The next special test is the varus stress test, and it's very much like the valgus stress test, except you are grasping the head of the tibia and applying a force medially instead of laterally, like so. The next one is the anterior drawer test, and that is testing for ACL sprain. You start with the athlete laying supine, like so, and with the affected knee flexed, like so. You place your hands on either side of the knee, making sure your index fingers are applying pressure to the hamstring tendon so that they are relaxed. And then you pull forward slowly. This test is positive with pain or laxity, and if positive, there is a possible ACL sprain. The next test is the Lachman's drawer test. This is also testing for ACL sprain, but it's often preferred because instead of this 90-degree angle, the knee would be at a 30-degree angle, like so. And it's preferred because this is less painful, and it also reduces the restriction from the hamstrings muscles. So to perform this test, you'd have your athlete in a 30-degree angle with their knee flexed up at a 30-degree angle, and then you would use one hand to stabilize the leg by holding the distal end of the thigh and the other hand by grasping the proximal end of the tibia and pulling forward. This test is positive with pain or laxity, and if positive, there is a possible ACL sprain. The next test is the pivot shift test, or the Galloway and McIntosh test. This is designed to determine anterolateral rotary instability, but is most often used in chronic conditions or as a sensitive way of testing the ACL. You have one hand at the head of the fibula and one hand at the ankle, and you have your lower leg internally rotated and fully extended, and then you slowly flex the thigh at the hip, flexing the knee as you go to a 30-degree angle. Once you're at the top, you apply a valgus stress and an axial load. This test is positive if you feel a shift or a clump, and if positive, there is a possible ACL sprain or a torn ACL. This is similar to the Slocum's test, which is the same process, just done on a side-lying position. The next test is the jerk test, or the Houston, and it just reverses the direction of the pivot shift test. So you go from a flexed position to an extended position, and if there's ACL insufficiency, the tibia will subluxate at about 20 degrees, and it would also be positive with a shift or clump, and if positive, there's a torn ACL. For the jerk test, you would start off at a flexed position instead of the extended position like in the pivot shift test, and you extend, and it's positive with the shift or clump, and if positive, there's a torn ACL. Next test is the flexion rotation drawer test, And you're going to start with the lower leg being cradled and the knee flexed at about 15 degrees. You're going to internally rotate the leg and flex it to about 30 degrees. This test is similar to the low C's test, which is the same, just in a side laying position, and you begin with the knee flexed at a 45 degree and then slowly extend to 20 degrees. The next test is the posterior drawer test, and that's testing for PCL instability. And you start with your athlete laying supine with the affected knee flexed at 90 degrees and the foot in the neutral position. You grab the knee on either sides, on both sides, and then you slowly move it forward and then push it back. And it's positive with pain or laxity, and if positive, there's a PCL. So the next test is the external rotation recurvatum test. The athlete is laying supine, and you grab the first phalange and lift the leg off the table. It's positive if the tibia is externally rotated and slides posteriorly. If this test is positive, then there's a PCL sprain. The next test is the posterior sag test, or Godfrey's test, and you start with your athlete laying supine with both knees flexed at a 90-degree angle, like so. And then you compare bilaterally. If the tibia on the affected side appears to be sagging, then it's positive, and if positive, there is a possible PCL sprain. The next test is the McMurray's meniscal test, and this is testing for a meniscus tear. The athlete is laying supine with the affected knee flexed like so. You're going to place one hand over the knee and the other hand at the ankle. You're going to make a circle with the ankle and pull into flexion, and it's positive if you feel clicking in the knee, and if positive, there's a meniscus tear. The next test is the athlete compression test, and you're going to start with your athlete lying prone with the affected leg flexed at a 90-degree angle. Then you're going to stabilize the thigh and apply a downward pressure to the leg and rotate back and forth like so. The next test is the athlete distraction test, and it's the same concept as the athlete compression test, except you're going to distract the leg instead of compress it. You distract the leg because that distinguishes the ligaments and the capsule from the meniscus, so we know which structure is injured. Your athlete's affected leg is going to be flexed at a 90-degree angle. You're going to stabilize the thigh, distract, and rotate back and forth. This test is positive with pain, and if it is positive, there is either a capsule problem or a collateral ligament problem. This is the Sally's test, and your athlete is going to be standing flat-footed for this test. You're going to stand in front of them, and you're going to support them by holding both of their outstretched hands. They're going to be standing only on their affected foot with their knee flexed at about 5 degrees. And they're going to internally and externally rotate their body. And they're going to repeat this movement 3 times. After they have repeated that 3 times, they are going to go down to a 20-degree angle, and they're going to repeat. And it's positive if the athlete reports discomfort or catching and locking. And if this test is positive, there's a possible meniscus tear. So this test looks like this. Now we're going to move on to the thigh. The special tests in the thigh are mostly manual muscle tests because there's no big structures other than the femur and the muscles around the thigh, or the muscles in the thigh. So if you're going to perform these special tests, you have to make sure there was no fracture. So if you suspect a fracture, do not do any of these special tests. You're going to begin with the knee in extension, and you're going to passively flex the knee as far as they can go. A muscle that has edema or a spasm will have restricted the passive motion, so that's how you would know that it is positive or affected. Active movement from flexion to extension that is strong and painful may indicate a muscle strain, but movement that is weak and pain-free may indicate a grade 3 or a partial muscle tear. Muscle weakness against isometric resistance, however, may indicate a nerve injury. Now we're moving on to the hip and groin structure. Next test is the Kendall test, and the athlete is laying supine with one knee flexed to the chest and the other knee flexed over the edge of the table. This test is positive if the thigh of the knee over the table is not touching the table, and if positive, the athlete has tight hip flexors. The next test is the Thomas test, and this indicates whether there's a hip contracture. The athlete is laying supine with arms crossed over the chest and both legs extended and together. You're going to place one hand under their lumbar spine and the other hand under their thigh and flex their thigh. It's positive if the extended thigh is not touching the table, and if positive, there's a hip contracture. The next test is the Patrick or Favors test, and this is detecting for SI problems. Your athlete is laying supine with the affected foot crossed over the opposite knee. You're going to apply pressure to the pelvis and then apply a downward pressure to the affected knee. It's positive with pain in the SI joint, and if positive, there's SI problems. The next test is the Janssens test, and the athlete is laying supine with the affected side over the edge of the table. The unaffected thigh is flexed towards the abdomen, and you apply pressure to the affected knee, like so. This causes the SI joint to go into extension, and it's positive with pain. And if it is positive, there's SI problems. The next test is the Nobel's test, and the athlete is laying supine with the affected knee flexed at 90 degrees. You're then going to apply pressure to the lateral femoral epicondyle and gradually extend the leg.
That's never going to stick, right? That's not supposed to.
It's positive with severe pain. The next test is the over test, and the athlete is laying on the unaffected side with the unaffected leg flexed at 90 degrees. The affected side is then pulled into abduction and extension, and once it goes all the way it can go, you are going to push it down to adduction. This test is positive if it's unable to abduct. The next test is the Renee's test, and the athlete stands only on the affected leg with the knee flexed from 30 to 40 degrees. This is positive if tightness occurs when pain is felt at the lateral femoral condyle. The next test is a Trendelenburg's test, and the athlete stands with the unaffected foot lifted. This is positive if the iliac crest on the affected side is higher than the unaffected side. And if it's positive, there's weakness in the hip abductors. The next test is the piriformis test, and the athlete lies on the unaffected side with the affected leg flexed at 60 degrees. You then stabilize the pelvis and apply a downward pressure to the affected knee, and it's positive with pain or tightness, and if positive, there's piriformis tightness, and this test looks like this.
You are all set your very own washer dryer.
The next test is the Eli's test, and for this test, your athlete is going to be laying prone. You then stabilize the pelvis and flex the knee. This test is positive if the hip on the side that is affected flexes, and if positive, there is tightness of the rectus femoris.